Suicide has become one of the leading causes of death in the United States. In 2020, 45,979 people died by suicide, which accounts for a death every 11 minutes.
Research shows that medical students are at a higher risk of dying by suicide than the general population. One student described medical school as a boot camp devoid of personality, emotion, or creativity.
Stress and burnout increased by more than twofold after starting medical school. A survey conducted at MCW showed that 50% of students reported needing mental health services but not utilizing them, and about 25% of students at MCW reported receiving a new mental health diagnosis since starting school.
Seeking Peer Outreach was developed by a medical student from the Central Wisconsin campus, Meg Lieb, and MCW Suicide Prevention Council following a suicide of one of the Medical College of Wisconsin's very own students, to address the stigma and isolation surrounding mental health and suicide in professional education.
The goal of SPO is to address the overwhelming statistics of medical student and healthcare worker deaths by suicide, as well as to increase the accessibility of mental health resources on the MCW campuses. To accomplish this, the program is divided into 3 distinct tiers, which work to address the stigma and isolation surrounding suicide and mental health.
Tier 1 individuals include all current students, staff, and faculty. This tier focuses on culture change by promoting group discussions and mental well-being activities on campus.
Tier 2 individuals consist of select students and faculty who complete additional training on suicide prevention and crisis intervention. This training asks them to be accountable for others' well-being.
Lastly, Tier 3 is comprised of 8 licensed mental health professionals and are utilized in situations that bypass the realm of a trained Tier 2.
After the soft launch of the program in the spring of 2022, the efficacy and quality of the program needed to be evaluated. Then M1 students, Justin York and Casey Balson, took the lead on the program and divided the evaluation into 2 separate projects that paralleled the layout of the program.
Justin's project focused on the development and implementation of the program to address stigma and isolation surrounding suicide and mental health, which comprises of the Tier 1 individuals. Casey's project evaluated the efficacy of the Tier 2 training.
Educating people on mental health and suicide prevention has been a long passion of mine. Many people in my life have been affected by mental health struggles, but it really changed when one of my close friends realized they were struggling with depression, and I'd missed all of the warning signs. I felt like I didn't have the tools I needed to look out for my peers. I think knowledge is power, and in order to be advocates, we have to know what to look for.
Mental health advocacy has been important to me since the death of an upperclassman at my high school. Sadly, this was not the only death by suicide that has impacted my life, and addressing this traditionally taboo topic is important to reducing the number of deaths by suicide, not only amongst healthcare professionals but also in the general population.
6 months after the SPO program was introduced on the Central Wisconsin campus, a survey was sent out to evaluate mental well-being. 92% of respondents reported feeling comfortable talking about mental health and suicide with their peers because of campus activities that paved the way for opening up such conversations.
A survey conducted to evaluate the efficacy of the training proved that knowledge on the subject built confidence in our peers to be able to advocate for mental health and intervene in mental health crises. Participants were asked to what degree they agreed with the following statement. If I am concerned that a peer is suicidal, I feel comfortable about how to handle the situation. Before completing the training, 70% either disagreed or were unsure, 20% agreed, and only 10% strongly agreed. After the training, the post-survey results showed 69% of people agreed, and 31% strongly agreed that they felt comfortable, and no one disagreed.
Of the first 2 years of the pilot program, it is working. People feel comfortable reaching out to peers about mental health, know why SPO was developed, and most importantly, believe that the stigma is being reduced. There have been several individuals who talk to us about how important this program is, and that programs like this are crucial to the mental health of soon-to-be physicians everywhere. Because of this, other institutions have reached out to us to talk about our program, how we have gotten such a large student involvement in the program, and where we see the program going as it becomes integrated across the institution.
We promise to continue to advocate for the mental health of our peers, team, and the community we are working with. Deaths by suicide impact more than the individual's families, and the entire community experiences a sense of grief. No matter how successful the program is, there is always more work to be done. It It is important to continually normalize the language and name it what it is, not dance around the subject anymore. Suicide and mental health can be prevented just like any other disease seen in the hospital, and it should be just as normal to talk about.